Hello, my name is Tracy Jensen, and I'm a public health major at the University of North Carolina, Greensboro. This is my presentation on cervical cancer in American Vietnamese women. What is the etiology of cervical cancer? Cervical cancer is an uncontrollable growth of cells in the cervix of a female's reproductive organs. And according to the Center for Disease Control, cervical cancer is the easiest gynecological cancer to prevent with regular screening tests and follow-up. It is also highly curable when found and treated early. The pap smear screening is the primary screening for detecting cervical cancer, and Healthy People's 2020 goal for females to be screened in America is 93%. Unfortunately, American Vietnamese women in America are only meeting its standard at 79% getting screened for cervical cancer. This leads me into discussing what is causing this health disparity among the American Vietnamese women. Cancer is diagnosed in American Vietnamese women at a higher rate in comparison to other Asian ethnicities and non-Hispanic whites in America. According to the National Center for Reducing Asian American Cancer Health Disparities, in the United States, the racial ethnic minority group to have cancer as the leading cause of death is Asian Americans. This is of high significance, as mentioned before, with only 79% of American Vietnamese women seeking cervical cancer screening. And considering that Asian Americans are the fastest growing ethnic group in America, the incidence of mortality and morbidity is going to increase significantly across the American population. So what is causing this health disparity among this ethnic minority group? The consensus between the research have been that there is low preventative screening for cervical cancer among American Vietnamese women. I determined that two of the determinants that is leading to the most reason to understand why this is happening is a socio-ecological model and cultural beliefs. So first, in looking at the socio-ecological perspective, is that it underlines the interaction of various factors and behaviors of American Vietnamese women and their low pap smear screening. According to the research, it was determined that an individual's characteristic of age, pregnancy, marriage status, and patient-provider relationships affected the individual's choice to seek preventative screening. For a majority of American Vietnamese females, pregnancy was their first interaction with a healthcare provider and pap smear screening. This indicates that the relationship development between a patient provider and the patient and the ability to communicate and provide education on and prevention screening of cervical cancer is very important. Followed along with that, the Vietnamese culture is fundamentally conservative, and due to personal beliefs, that Vietnamese women do not in themselves believe that they are at risk for cervical cancer. Some of these beliefs are that one is not sexually active until marriage, and personal efforts in cleanliness will aid in preventing cervical cancer, and mothers as a primary source of health advice propagates this American Vietnamese women belief that they are not at risk for cervical cancer. In conclusion, some interventions that we can follow up are to help with this, that to understand why and to solve this disparity of the American Vietnamese and the high risk of cervical cancer is that involving some of the combination of their beliefs and Western medicine is that if we can get out the education about the pap smear screening and combine, but do it in a culturally sensitive way, it will automatically help to improve the relationship with the patient and the healthcare providers. Furthermore, the healthcare provider and patient relationship is also important, but we also need to look into community outreach in informal settings such as church or community gatherings, which offer a very safe place to disseminate the benefits of the pap smear screening and not only rely on a patient-provider relationship. I appreciate your time, and I hope you enjoyed my presentation on cervical cancer within American Vietnamese women. Thank you.